Diabetes is a disease in which the body's ability to produce or respond to the hormone insulin is impaired, resulting in abnormal metabolism of carbohydrates and elevated levels of glucose in the blood and urine. According to the basics of type 2 diabetes, there's about 27 million people in the United States that are suffering from diabetes, and another 86 million people that are suffering from prediabetes. The Healthline states that when you have diabetes, you are also at risk of other health issues, including the risk of stroke, loss of consciousness, extreme thirst, and foot problems. Type 2 diabetes used to be called adult onset or non-insulin dependent diabetes. In the article that was written by Joslin Diabetes Center, they stated that 90 to 95% of all cases in the United States are type 2, which is the most common form. Type 2 diabetes usually occur in people over 40 years old, who are overweight, or if they have a family history of the disease. Diabetes is more common among Americans, African Americans, Latinos, and Asians. Once you have diabetes, it becomes a disease that you have to live with for the rest of your life and cannot get rid of. Insulin is a hormone produced in the pancreas by the islets of Langerhans, which regulates the amount of glucose in the blood. The lack of insulin is what causes diabetes. Your pancreas makes the hormone insulin. The Healthline states that after we eat or drink, our body will break down sugars from our food and turn them into energy. But in order to do this, our pancreas has to be able to produce insulin. The American Diabetes Association says that your pancreas starts out producing extra insulin, but over time can't continue to do that to keep your blood glucose at normal levels. It also states that blood glucose monitoring is the main tool that is used to keep your diabetes under control. If glucose levels get too low, it can cause you to lose the ability to think properly, and if they are too high, it can cause damage of complications to the body that can last long term. You can check your glucose by pricking your finger with a blood glucose meter. After washing your hands, insert a test strip into the meter. Next, use the lancing device to prick your finger to get a drop of blood. Then, touch and hold the test strip to the drop of blood and wait for the results to show. The results will show up shortly on the meter's display. The American Diabetes Association also states that the target blood glucose level is 154 milligrams per deciliters. Before a meal, it should be about 80 to 130 milligrams per deciliters, and about 1 to 2 hours after a meal, it should be less than 180 milligrams per deciliters. Now, I'm going to talk about the long-term effects that it can have on your body that I mentioned before. According to Healthline, one long-term effect that diabetes can have on your body is that it can damage your kidneys and affect their ability to filter water, waste products from your blood. Doctors can catch this by seeing that you have too much protein in your urine. Diabetes also raises your risk of having high blood pressure, which is one of the most known side effects of diabetes. Having high blood pressure puts a lot more strain on your heart than what needs to be. Over time, having high blood sugar, fatty deposits start to form in the blood vessel walls, which in the long run can cause the blood vessels to harden and restrict or completely stop blood flow. This ends up causing pain to your hands, feet, legs, and the rest of your body. Diabetes also causes damage to the large organ of your body, your skin. It causes it to become very dry and crack. It is recommended to use petroleum jelly and gentle creams to help prevent this from happening. Diabetes also causes neuropathy, which is damage to your nerves. This affects the way you perceive heat, cold, and pain. It can also affect your eyesight and eventually can cause you to go blind. If your doctor tells you that you have been diagnosed with prediabetes, that doesn't mean that you are for sure going to get it. There are ways to prevent it. According to WebMD, the first step you should take is trying to lose weight by dieting and exercising. In a study that was conducted, people that had a few extra pounds or that were obese were the ones that were predicted to get diabetes. The study showed that over a 16-year period, regular exercise, which is 30 minutes a day, 5 days a week, greatly decreased the risk of getting diabetes. Exercise and a good diet is the #1 prevention of diabetes. In conclusion, I hope you can understand that diabetes is a serious disease, and without proper treatment, it can damage your body in ways that cannot be undone. Remember that even at our young age, we can take steps now and for the rest of our lives so that we can avoid getting diagnosed with pre-diabetes that can eventually turn into diabetes.